Hi, I'm Dr. Jeff Waldron. Today I'm going to discuss the one main reason you may not be getting better from the exercises that you're doing at home. And this reason is substitution patterns. So in this video, you're going to really want to watch and pay attention. I'm going to show common substitution patterns in the shoulder when you're trying to strengthen the rotator cuff, and then common ones that we find for low back pain and hip issues, and what people are doing wrong, and how you fix it and make sure that you get the most out of your exercises. Okay, so we're going to talk about common substitution patterns of the shoulder when we're strengthening the rotator cuff. One simple exercise that's often used is pulling with a band out to the side to try and help and strengthen the cuff and turn it on. The one thing that I see with this that's most common is that people will not get their shoulders set in the correct position before they begin. So you want to have a good posture as you're doing this, straighten up, get your shoulders set back as you begin, and then you want to just pivot on the elbow as you do this. So if I turn to the side here, you can see we start to go over and back, bringing the arm out to the side. You want the elbow to stay stationary, and you want to just rotate and go slow in a small movement. You don't want to get all this movement of the wrist flicking back and forth. If you're coming out and the wrist is flicking, that's wrong. If you come out and the elbow starts to straighten, then you're getting more of your tricep and less of the shoulder. So this would be wrong. This going down here like this would be wrong. And if your shoulder's forward like this and you're doing it here, that would be wrong as well. So it's important to keep your elbow just to your side, pivot out to the side, holding the wrist still, keep the shoulder nice and still. The other substitution that happens is the shoulder blade starts to move all over. So as you're doing this, you're getting this shoulder and back movement. So as people get tired, they're starting to use their back and move all over. When we're doing exercises to make them effective, you want to make sure that you're exercising the joint and the specific muscles you intend to, and you don't get something different. So just go ahead and hold it still, move nice and small, controlled motions, keeping the elbow still and the shoulder blade and all of this area nice and still as you do the exercise. The next thing I'm going to show you are some exercises we often use for the hip and the back. They're clamshells. These are commonly done incorrectly because people start to use their back or they push off on their toe to do these, and so they get in a position and they go to move and they're getting a lot of back movement instead of holding the back still and moving only the hip. So you want to make sure when you do these, you do them correctly, because they'll be therapeutic if you do them the right way. If you're substituting, they may start to cause more back issues or hip issues. So I'll show you a couple lying down. So when you lie on your side here, you want to get lined up. You want your hip rolled forward, and then you want to just lift the knee slowly. Don't push off of the toe down here when you do it. Keep the feet stationary, and then nice and slow, moving just from the hip. If you find yourself rolling doing that, then you're going to get pinching in your back, and that could increase pain and hip pain. So keep it nice and still, going up and then down like so. The other one that I like to give people is on their hands and knees doing a clamshell. So when you get there, you want to kind of keep your hip pressed forward. So when we're in this position, as we go to do the clamshell, think about the front of your hip bone here just pointing towards the ground, and then you're just going to move the hip out to the side nice and slow. If you start to get all this back movement, then that's not going to be helpful. So holding it nice and still, having yourself set, and then just rotating the knee in and out from the hip without using the back, keeping this front hip bone just pointed down towards the ground. I just showed you some of the most common substitution patterns for strengthening the rotator cuff and the hip and back. You can apply those same principles to any other joint in your body, whether it's your jaw and you're moving, or your neck, or your foot or ankle or knee. Make sure that you're holding that joint still and really executing a small movement and controlling it. And if you're not getting success, then talk to your physical therapist or whoever you're working out with, and make sure they give you a little feedback that you're holding that joint still and really getting the movement pattern that you desire. So hopefully you find that helpful. And if you do, please share the video with friends and family. Thank you for watching.